Patients often ask me, why does it take so long for them to heal? In fact, for that matter, why do they have to come in so frequently in the beginning of care? Sometimes I will see a spine on an x-ray that looks sort of like this, where the spine is not going straight up and down. There's a kink in it, and it's rotation in some fashion. So how does the spine get that way, where it's rotated off position? Well, work, stress, anything that you do in life tends to set it off. You have a job where you put yourself in a position where your head is down looking at a computer for all day long, for 5 days a week, for 8 hours a day. Well, what is it that's going to happen to your spine? Your spine is going to shift. Tightening is going to occur on the front side with the soft tissue. It's going to elongate on the back side of the soft tissue, and the bone is going to remodel based upon that over the course of time. The spine doesn't just move freely. These ligaments hold the spine in place and hold it there tightly. So to help your spine remodel properly, there needs to be a force application and a change in some fashion and habit in order for your body to make change and make it more permanent. But it doesn't happen immediately. It takes time for that to happen. The same way that it took time for your spine to degrade, it takes some time for your spine to reestablish a normalcy of some sort. In the course of a couple of days in the early stages of care, the spine is going to shift back into its more familiar position because the ligaments are used to holding the spine in that position. It's not unusual to see that a person is coming in more frequently, and if they're young, that frequency will change very rapidly, and if they're older with a spine that's changed physiologically, anatomically, well, then it's going to take a little bit longer for that to happen. Depends upon the age, depends upon the stresses on the spine, depends upon if there's degeneration to the spine. But all these factors will play into the frequency of care and the duration of care as well. Not to mention the person's habits, their occupational stresses, and their compliance with care, their compliance with doing home exercises, their nutrition, because inflammation, whether or not they smoke, can also affect it. There are numerous things that can impact the body in the process of healing. So if your chiropractor is suggesting to you that you need to come in 2 or 3 times a week for so many weeks, it's not unusual. That should taper off over some time duration, again, depending upon the stresses on your body. It may be a short duration, it may be a very long duration, depending upon how your body presents and what the chiropractor is doing to reevaluate to see what progress has been made.